Good afternoon, ladies and gentlemen. After some technical difficulties, we are now live on. I do want to welcome everybody to this Tuesday, January 19th, 2021 public meeting of the Board of Garrett County Commissioners. Welcome everybody who joined us today. I'd like to call this meeting to order. Mr. Knoll, are there any additions, deletions, corrections, public meeting agenda?
No, sir, there are not.
Hearing none, do we have a motion to accept the public meeting agenda?
So moved.
We have a motion, we have a second.
Second.
Motion is second, agenda approved by mutual consent. Everybody got a copy of the minutes in advance of the meeting. Are there any additions, corrections, concerns to the minutes? Hearing none, do we have a motion to approve?
So moved.
We have a motion, we have a second.
Second.
Minutes approved by mutual consent. We do have a proclamation today for Human Trafficking Prevention Month, January 2021, and it reads, whereas human trafficking is a horrific assault on human dignity that affects people in the United States and around the world. It tears apart communities, fuels criminal activity, and threatens the national security of the United States. Whereas recently as 2019, there were 187 cases of human trafficking reported in the state of Maryland, with approximately 25% of all victims being children under the age of 18. Whereas we reaffirm our commitment to support the efforts to end this abhorrent evil, to support victims and survivors, and to hold traffickers accountable for their heinous crimes. Whereas tragically, through force, fraud, and coercion, human traffickers deprive millions of victims of their rights to life, liberty, and the pursuit of happiness. Whereas this intolerable blight on society involves exploitation for labor or sex and affects people of all ages, genders, races, religions, and nationalities. Whereas we need to remain focused on ensuring that survivors of these horrific crimes receive the care and support they need and deserve. Now, therefore, we, the Board of Garrett County Commissioners, do proclaim January 2021 as Human Trafficking Prevention Month in Garrett County and call upon law enforcement, private businesses, faith-based, and other organizations of civil society, schools, families, to observe this month with appropriate programs and activities. Signed by the order of Commissioners Heinball, Titchnell, and myself. Next up on the agenda, we have Mr. Bob Stevens, the Garrett County Health Department, with the COVID-19 update. Bob, what's happening?
You're muted.
Good afternoon, gentlemen. Thanks for inviting me to speak before you, and also the opportunity to speak to our general public who I know is tuned in on the Facebook feed and some of the other social media. So I did just want to briefly say that our numbers here in Garrett County have stabilized a little bit in the last couple of weeks. We've gotten past that Christmas surge. I would say that I just can't emphasize enough how devastating this COVID-19 is on an older population. We now have 56 deaths that are that COVID-19 has contributed to. A few of those have no other factors except for the fact that they had COVID-19, so they didn't have anything else. That was the only thing. There are many, though, do have underlying health issues, and many are elderly. Our age group, our youngest in Garrett County has been 18, and the oldest has been 102. 56 of the 56 that have died, 38 have been in nursing homes. So it's really important that we protect our older population. Certainly the vast majority of the group that has passed away has been over 75. And so I just wanted to bring that up. I can't also, at any time I'm before any people, I want to also talk about what we can do to stop the spread of the virus. And then I'll get to talking about the vaccine, which is what everybody really wants to hear about. It's really critical that everyone take the proper precautions. And just to reiterate, the masks work. We're seeing a lot more compliance in the community, in larger settings. People have, I think they've gotten to the notion that if they're in a public setting, they need to be wearing a face covering. However, I would also just encourage people that if you have people in your home and they're not people that you live with, that face covering is a good way to protect the people that come in. Also, being socially distanced. I emphasize all the time that when we get COVID-19, we're going to probably get it from somebody that we like, somebody that we're close to, whether it's somebody that we work with, we're close friends with, they're a family member, we socialize with them, or maybe go to church with them. And so, you know, it's sneaky like that. And so we have to have those precautions and wear that face mask and keep that social distance. There has not been any significant changes with the executive order since regarding face covering since November. So it's still, we get that question frequently, where we stand now. And so that executive order from November 17th is still in place. If you're sick, people need to stay at home, get tested, isolate if they're sick, quarantine if they're around somebody who has had COVID-19. And then I would also mention that, you know, we're continuing to do the mitigation and trying to do the enforcement. Once again, you know, we field those calls, we do the visits, and we follow up on those. Our environmental health staff do lots of spot checks to make sure that people are being compliant when they're in restaurants, when they're different places like that. I would, if it is possible, I'd like to share my screen. If Mr. Knoll would be able to allow me to do that, I'll show the screen, and because I want to talk about the vaccine and kind of how that's working. So there we go. This is what I want to show right here, and this is the state plan for how COVID-19 is being the vaccine is coming out. And you can see that there's it was essentially 3 different phases: phase 1, 2, and 3, and then they've divided phase 1 up into 3 different sections. The first is phase 1A, and that's healthcare workers, residents and staff, nursing home, and first responders, and so forth, public safety. We have essentially gotten all the way through that phase. Governor announced last week that we could move to phase 1B, and we are well through a lot of phase 1B. This week we will finish up with the assisted living and congregate settings, and we will have vaccinated over 600 people already that are age 75 and older. And then there's also the education and continuity of government. We have to get through those phases before we move to the phase 1C. The governor has said as early as next week we could move to phase 1C, but we're not going to be there because the state only gets about 72,000 doses of vaccine in a week, and we get about 400 of those doses here at the health department. That those 72,000, some are distributed to nursing homes, to hospitals, and also to federally qualified health centers. To date, the good news for everybody is that we are at 6.75% of our population has been vaccinated, and that is nearly double the state. The state average is 3.65. And we vaccinated 1,959 people in Garrett County. So we're doing better than any other county in the state. We'd like to stay there because that's ultimately what's going to stop the spread of this virus. We can continue to do all those things like the social distancing and face covering. We need to encourage that. We need to do that, but it's really important that we get the vaccine. So. I'm going to go back. I'm going to stop sharing after I showed that screen. So we think that we'll probably get through phase 1B in about 3 to 4 weeks because there are basically about 3,500 people in phase 1 and phase 1A and 1B combined. And again, we're through about 1,900 of those. So that's really good news. I don't think there's probably a county in the state that has gotten that far. And so with continuing to get 400 vaccines a week, our priority now is with the 75 and over population. We're working on them, and then we hope that we can get through them in the schools and then quickly move to the 65 to 75-year-old population. And so we're hopeful to be doing that in again, 3 to 4 weeks. I want to emphasize one of the things that we're trying to do is we are working with, we have constantly tried to work with our most vulnerable populations, which is why the nursing homes went first. But then we're also working with the Area Agency on the Aging and primary care offices to refer their 75 and over population who is the most at risk. And so tomorrow around noon, we'll publish on our website, and we'll make an announcement on the radio and so forth, that we will have our website will be open and have a link on it that will allow people to register, self-register for the vaccine clinic that is on Friday. It's very easy to do. If people have any kind of internet skills at all, they will be able to do it. Because of this is an older population, they might want to have their granddaughter or have their son or daughter help them to register. They'll also be able to register. We'll publish a telephone number at that time to help people to call in. But it's going to be frustrating when you call in because we don't have a lot of people to man all those calls, and it takes quite a bit of time for somebody else to register. We can, if we had 400 people that wanted to register at the same time online, they could do that. But when we're registering people here at the health department through a telephone line, we can only do about 4 or 5 people at one time, and it takes 10 to 15 minutes. So you can see that the most efficient way is to register through that link. So watch our website tomorrow around noon, and you can get on there and you can register. I have to emphasize, I'm trying to talk very fast here, but if somebody registers and they are not over 75 years old and they do not work in healthcare or in public safety, they will be turned away even though they are registered. And so when people come to the clinic, they need to be able to show their ID and prove, that they are a law enforcement officer, or they're an EMT, or they work for a particular doctor, or that they're 75 and older. If they're not, we just have to turn people away. One of the things I did want to emphasize is that we get a lot of calls from people that have other health issues, and they make a very good case by saying, I am, I'm in my upper 60s and I have some of these health concerns, and I believe that I should get the vaccine before a 22-year-old teacher should get the vaccine. And that's a very good case. But public health is in the role of population health. We look at entire segments of the population. So, we try, what the health department is all about is trying to prevent sickness and illness and injuries and those types of things. So we specialize in prevention. The way we do that is we look at an entire segment and work on that. So if you had, if for instance, you were asking us about putting in a sewage system in order to protect people from cholera or some type of waterborne illness, we would say, well, we want to put it in where we get the most bang for the buck, so it's a large group, rather than saying, well, we need this one person who lives 10 miles from this larger town. That one person, they're really at high risk. Well, what we would do is we would hope that their healthcare provider or somebody could help them get bottled water or whatever to get them through that process. So what I'm saying is that hopefully that the private providers will be signed up in order to provide the vaccine, and that because it will soon be available. It's not available now, but it will soon be available through pharmacies and through the healthcare providers who choose to sign up and become vaccine providers. When that happens, they can take care of their most high-risk people. And because the health department, we're not aware of people's medical concerns. And so it puts us in an awkward situation where somebody, just tells me that they believe that they should go to the front of the line because they have a medical issue. We are not in a position to do that. And so we've been working with our healthcare providers to help prioritize that group and stay within those segments that the state of Maryland has designed. So at this point, we're really trying to call on our healthcare providers and other partners to help us prioritize. But tomorrow at around noon, it doesn't matter if somebody is the picture of health. If they're 75 and older, they can register for that vaccine, and that's just the way it has to be done that way. I totally understand when people, they call us and they tell us, why they should be headed up, further up in the line, and maybe they should, but we are not their doctor. We can't make that decision on our own. So unfortunately, that's where the situation is now. It will stay that way probably until another vaccine is approved. We know that there's 2 vaccines that are approved now, the Pfizer and the Moderna vaccines. But when one of the other vaccine manufacturers, when they get an emergency use authorization, then the state will have more vaccine available, and hopefully more providers will be able to come on. And we're just looking forward to that day when anybody who wants a vaccine will be able to get a vaccine. Right now, it just has to be, we have to go through this pyramid and go through those stages. So with that, I would just ask if anybody has any questions.
Just a real quick review. The clinic on Fridays at the Medco building at McHenry for 75 and older.
It's 75 and older. We might have, 1 or 2 healthcare providers who missed out earlier, and or a law enforcement officer or somebody who may have missed out, and so there might be a couple of those folks who by virtue of what their job is, they'll be able to go in. So when we work down that pyramid, we do everything above the certain level. So right now we're working on everybody that's 75 and older, plus the people above that, which is the medical care individuals, people who are also in public safety.
Okay, and people will be able to register by phone and online. Is that correct?
Yeah, they can register. You have to come. You have to have an appointment. If you don't have an appointment, we can't see you.
But they make
no.
it online or by telephone.
Excuse me, I have a hard.
Yeah. They can make the appointment either online or by calling in. Is that correct?
That's correct, and we'll have that number published on our website at the same time.
But they won't be able to do that until you publish something on your website. Is that correct?
And yes, and we'll put that on the radio, and we'll try to get it out as many ways as possible. But that's going to be somewhere around noon tomorrow.
Okay. And even though the governor has made an announcement that says that we can, that beginning next Monday on the 25th, you can start giving the vaccine 65 and older, that's not going to happen in Garrett County because we don't have sufficient vaccine. Is that correct?
That's correct. That's where it is. That's the way it is everywhere. There's not sufficient vaccine to go around, so we're staying within the most high risk and then moving up. I believe that's what most health departments are doing. But if you just open it up to that next, if you get to that 1C population, that's probably going to be about 10,000 people in Garrett County are going to fall into that category, and we're still only going to get 400 vaccines a week. And so, we can't register everybody. So that's why we're trying to say, well, we're gonna work through this in as methodically as possible.
And the last point, even though there's been some information published that Walgreens and other pharmacies are going to be involved in administering the vaccine, they don't have any vaccine to administer yet in Garrett County, do they?
They do not. What they have is the vaccine that they were administering at the nursing homes. So they were a partner, and they did the nursing homes and some of the other congregate living. And so that it is confusing because people have made that announcement and said Walgreens and CVS has it, but that was just for the nursing homes. When they do receive it, we look forward to the day when they receive it, because then people can go to their doctor and their doctor can say, this person needs to go here because, they could be, 25 years old and have lots of health issues, and maybe they're the one that really needs it next. And that's who's in the position to do that.
But when the pharmacies start administering the vaccine, people will still be required to have an appointment that'll come from their healthcare provider.
I am not 100% sure of that. I think that my opinion is the health department needs to do the public health part of it, and the pharmacy should do the medical care component.
Thank you.
Anyone else have any questions for Bob?
This is Carl Schwam. Can you hear me?
I can.
Do you hear me, Bob?
Yes.
Okay. Do you want to emphasize it's only Garrett County citizens? Nobody from Pennsylvania or West Virginia?
Proof of residency is required when people come in. So we will be asking for proof of residency. And I will say that, there are some people that will say, I have residency in two different, I have a place here, and I spend 6 months here and I spend 6 months in Florida. Well, bring us a water bill that has your name on it, something that can prove that you're, or a tax bill or anything like that. Doesn't have to be the address on a birth or on a driver's license, but something to prove that you're paying taxes or that you do have residency here.
All right, Bob, anything else for us?
No, but this is kind of a good segue that I just, Dr. Schwam had spoken up, and I'm sure you're going to introduce him, but I'll just say that, Dr. Schwam, and there's been a group from with Dr. Sisler and Mary Van Sickle and Dr. Corder, our deputy health officer, have been working on adolescent health work group. And I'm really looking forward to hearing a lot of the progress that they've been making, because they're really doing some great work.
All right, and as always, Bob, want to thank you for all that you're doing and your time and dedication to the citizens of Garrett County in dealing with this epidemic. I know it's time consuming and not always socially rewarding, but we do appreciate all your time and effort. So thank you.
And it's probably about to get controversial in terms of people wanting to get the vaccine and competing for it. There's going to be, I'm sure there's going to be some people that get mad and upset, and then it's going to require a lot of patience to get through this for the next few months.
It already has, and and I just say that that's why in Florida they had some unrest. They had 75-year-olds getting in fist fights after waiting all night long in line to get a vaccine, and so that's why we are only taking people who are registered, and we also have a deputy sheriff there, as well as trained counselors who can help to de-escalate any type of situation like that. But yeah, it's been an interesting ride. Thank you.
Thank you.
Thanks, Bob.
All right, next item on the agenda, as Bob mentioned, we do have the Child and Adolescent Health Work Group update, and Dr. Carl Schwam. Dr. Schwam, thanks for joining us, and we'll turn it over to you.
Thank you. I wanted to, I have a slideshow, and then I've got Bob and Mary Van Sickle, who's from the schools and counseling, and Stephanie Sisler, who's a pediatrician and can give the viewpoint of pediatrics. So what I'd like to do is, if I can share the screen and give a slideshow, and I'll explain background.
There you go.
Okay, can you see my screen?
Yes.
Yeah.
Can everybody see my screen?
Yes.
Okay, good. So let me get to, so The purpose of our group is to improve physical and mental health in the children of Garrett County. Our group is 3 years old. It was my idea to start the group, and really we just had one purpose at the beginning of this, and that was to get kids in for wellness physicals. We are technically an offshoot of the Health Planning Council, and you all have heard at least some reports from me at the Health Planning Council. The reason I thought this was a worthwhile thing to do is at the Health Planning Council, we have received a lot of statistics, but the statistics about our adolescents are really shocking to me. In many categories of health statistics for adolescents, we're either the worst or nearly the worst in the state of Maryland, which to me is sort of, I think we have an excellent school system. We have lots of kids who go to state and sports. We've got kids that are going to fishing tournaments in Alabama and stuff like that. So, you know, on one side, we have a lot of really good things, but when it comes to overall health, we're just not as good as I think we should be. The statistics that I will be showing you are from the youth risk behavior survey and the state health improvement process. The members on our committee, some are from the health department, local behavioral and medical health providers, social services, Mountain Laurel, hospital, school system, nutrition. We have a nutritionist. And part of the reason or an explanation for why I thought we should form the group, the human costs for these health statistics, we have very high teen pregnancy rates. We have the highest rate in the state of child abuse and neglect all over the US. I don't have rates for here, but for the US, the suicide rates are going up. Addiction rates here are going up. And there's just increasing stress on families and schools. And this was before we had COVID, so has made this worse. Monetary costs, the police and the judges say that 2/3 of our current cases are drug related, and therefore that's one of the risk factors for our kids. Social services, we have increasing child protective care cases, newborns affected by drugs and pregnancies, schools, teachers and parents and students are all just more stressed than ever. And businesses, I've heard businesses tell me they have trouble filling slots because they don't have, the kids that are coming out of school are not what they're looking for. A lot of them are affected by drugs. Examples of our statistics. So kids coming in for annual wellness physicals, we're the worst in, at least as of a couple of years ago, we were the worst in the state. Tobacco products, we're the worst in the state, almost 3 times worse than the best county in the state. That includes cigarettes and smokeless tobacco. Vaping, we don't have as much measurements, but we know that 50% of our students have already tried vaping. Alcohol is also really bad. 70% of our students have tried alcohol, a quarter of them before they were 13. That's kids in grade school have used alcohol. Binge drinking is really bad. Almost a quarter of our students have had 5 drinks in an hour within the last 30 days. Cocaine is not a huge problem here, but you can see police say this is a rising problem and maybe even as bad or worse than opiates. I'm not going to list all these. I'm not going to discuss all these things. Bullied at school, 27%, and it's worse with girls. Child maltreatment, we are 10 times worse than the best county in the state. That, to me, that's unbelievable. 10 times as bad. So what has this group done so far? We started out with trying to get kids in for wellness physicals. We feel like if we can get them in for wellness physicals, we can talk about drugs, alcohol, cigarettes, and if you get them in every year, you can pick one of these topics every year. Health education. Worcester County has a pilot project that we were talking about also implementing, but weren't terribly successful because the cost is a problem and people to implement such a program. Integrated health education is teaching health issues in English class, math class, all the different classes, rather than having a 9th grade health class where all you teach is health issues. Right now we've focused on behavioral health, and I'm going to after I give a few statistics, I'm going to let Mary Van Sickle and Stephanie talk about that. Solutions. It's like with Bob, he's in this COVID crisis, everything sounds like bad news, and everything I've said so far is kind of bad news. So our parents, they're the primary source of where kids get their information and learn habits and whatever. The problem is we have a fair number of parents who don't parent or parent poorly. The schools are probably the second most important place to learn about health issues. Healthcare system is to better educate. The hospital, don't know how much you know about this, but the hospital is has increased pressure to educate people and to keep people out of the hospital. In other words, to make people more healthy. So it's not just the doctors and nurse practitioners, but the hospital is now being expected to, and their payments have to do with how well the overall health of the population is doing. Extracurricular activities, 4-H, scouts, sports, those sorts of things. They don't have as much emphasis on health, but they're a place it can be done. Church, youth groups, they can be a place. And there's special interest groups like ours. And our main focus is educating and advocating. We don't really have a way at this point of getting money to help out. I'm sure because of the Health Planning Council, you know about mygarrettcounty.com, but I just want to emphasize it. Mainly it was started out for health and exercise topics, although now there are many other special interest groups that are on mygarrettcounty.com. There's a new platform they just have initiated recently called GoGarrettCounty.com. And I'm not totally versed in everything this platform does, but I think a lot of videos are on there, especially for people that like getting information from video sort of sources rather than reading online or reading a book or the newspaper. So I'm going to give a couple of things about mental health, and I'm going to turn it over to Mary first and then Stephanie. In late 2019, early 2020, before COVID hit, we did a survey of middle and high school students and their parents. So we had 4 groups: the students in middle and high school and the parents of those students in middle and high school. And the big surprise in that survey was 40 to 50% of each of those 4 groups identified the most important health factor to them as being in their students: stress, anxiety, and depression. I just figured it would be alcohol, drugs, those sorts of things. But all 4 groups rated these things the highest of their concerns. So we had already decided before COVID to address behavioral health, and then COVID only made that more important. Recent Maryland YRBS statistics showed that the use of illicit drugs, amazingly to me, is somewhat downward. It's only slight. And we still have an opiate, and in this county at least, methamphetamine crises. Violence, 7% of kids didn't go to school due to safety concerns in the last year. This is for Maryland. This is not just Garrett County, but bullying clearly is getting worse everywhere, including here, and it's worse in females and it's worse electronically. Physical and dating violence, 8% of students have experienced that. And then you get to mental health and suicide. 37% of students have experienced persistent sadness. That means like for 2 weeks running. And it's more prominent in females. Seriously considered suicide, also more prominent in females. Attempted suicide, more prominent in females. And that's, there's one more thing I wanted to say, just in general. I think our group has concluded that we have 9th grade health classes. There are some health discussions before that age, but that's when most health teaching is done. The problem is most kids have already developed bad habits by then. We need to address a lot of this in middle, and some of these things even in grade school. You know, something like bullying, that can start early, and somehow we need to address all these things earlier. 9th grade's just too late. So Mary, you're on.
Thank you, Dr. Schwam.
You need to, yeah, okay.
Alrighty, well, good afternoon, gentlemen, and thank you for letting me present. My name is Mary Van Sickle, and I'm the mental health coordinator for the Garrett County Public Schools. I did not prepare a nice PowerPoint like Dr. Schwam did, but I wanted to let you know that you know, Garrett County Public Schools for really very many years has worked very hard to support the students with, you know, mental health concerns. And when Dr. Schwam asked me to join the group in the spring, and he shared with me that, you know, children coming in for well checks, just regular appointments with their family care or primary care providers, were expressing, you know, concern about anxiety, depression. I was worried that those were some of the children that we were not literally capturing in our school system. And certainly as my job, it's to link children and families with services, both within our community as well as outside of the county if necessary. So in looking at some of the statistics that, you know, I've been collecting, and this is the 2nd year that my position existed in the state of Maryland, and it came about through the Maryland Safe Schools Act. For example, last year prior to COVID, we had 166 children, and this is children from elementary through high school level, who made threats to either kill themselves or threats to harm others. So 166 children last year prior to COVID and our school system shutting down virtually were assessed by our school staff. And counting myself, we have 19 staff that are all, master's level trained, either counselors, school social workers, or school psychologists. And of the 166 students that made threats last year, 8 children, including in that count, were hospitalized psychiatrically for further treatment. And unfortunately, we have no local, inpatient units. So the majority of the kids are hospitalized either at Brooklyn and Hagerstown or farther east. And this has been a difficult situation for many years, just because when a student's hospitalized out of county, it's very, very hard for their families to participate in therapy, visitation, and those kinds of things. As you can imagine, with COVID, in essence, shutting us down virtually in the spring, we were certainly opened under a hybrid model and shut us down again. Our numbers are not nearly as high as what we had last year, but we have so many children that we just are not sure how their mental health is, because they're so disengaged academically with our system right now. We have children who aren't showing up for, their school lessons online, won't answer the phone, won't answer the emails, won't respond to text from their teachers, their principals, the school counselors, school social workers. We have a number of kids that I'm very, very, very worried about in this community of any socioeconomic group of, all locations throughout our county. We as a school system have made more home visits this school year, 2020, 2021, excuse me, than we have in the last several years, just checking on the welfare and mental health of these children, including myself, our pupil personnel worker, Lindsay Struben. We often go out with a school resource officer if we suspect, that there's any potential violence or drug issues in the home. So we've made many, many more visits this year, just checking on children, making sure that they're okay. As you can imagine, we've made many referrals to our local Department of Social Services for Child Protective Service referrals. But I do feel that we are sort of at a crossroads, and that obviously we're going to remain virtual for, another period of time. The metrics will certainly determine when we reopen, but we have a number of children who are really suffering. And some of these children certainly would not be the ones that are accessing healthcare right now, or people aren't necessarily seeing them, in any type of professional setting. And then just to kind of complicate things, we have a number of mental health providers or behavioral providers that have staff shortages right now. So recruiting professionals that work with children in our community has always been difficult. I suspect it's even harder now. Right now, sort of anybody in healthcare, because of COVID and the impact that it has caused on every county in this country. Mental health professionals are at a very high, high shortage area. So, I'm kind of asking as a county to sort of look at any type of options or, potential for expanding services that we could possibly find. I think our school system will certainly continue to work very, very hard in, supporting our children. And I'm very glad that, Dr. Schwam and Dr. Sisler, have spearheaded this group and become very aware of what it looks like to be a student or a child in Garrett County. And so that's all I have. And any questions?
Thank you, Mary. Stephanie, do you have some things to add?
Yeah, so I think Dr. Schwam did a great job of summarizing the data and kind of the research side of things that we're seeing in Maryland and in Garrett County specifically. So I think my part, along with Mary, is just to kind of reiterate that clinically in the real world, we're seeing exactly what's on the numbers. We have limited resources. I have many, many patients who we have a really difficult time finding mental health services for. More than that, it's finding parent resources, finding counseling for my parents, especially the huge number of grandparents or non-biological parents that are raising children. I'm a foster parent personally, and just working with our foster families locally. We just need more support, not just for the kids, but for the parents and for the families that are raising children with a trauma history. In a recent week in clinic, I had 4 brand new, never discussed severe anxiety, depression patients. 2 of those ended up hospitalized, psychiatric facility, not local. And as Mary mentioned, that's a huge burden on families. Even the admission process the families have to travel and physically sign the child in. So there's just so many barriers. As I mentioned, resources are hard. Insurance becomes barriers for many of those things. You may be able to find a provider for the age group, but do they accept their insurance? Is the family able to travel? And as Mary mentioned, just recruiting is very difficult. So we're definitely seeing on the clinical side all of those barriers and increased rates of all of these things.
So just sort of to summarize, why are we bringing this to the commissioners? One is just to educate and really we want the public to know there's really some really serious problems here that are under the surface. I don't think, everybody understands COVID is difficult and we have some drug issues here, but I don't think anybody really understands how bad it is. And at some point, the commissioners, because you hold purse strings, may be able to influence, I don't know, maybe with the hospital, maybe with Board of Education, whatever. At some point, you may be able to say, yeah, we think this is a really good idea. We don't have anything specific to ask you for, but just so you know what's going on, and maybe at some point in the future, you'll have a voice in this.
All right, well, thank you guys. Does anybody have any questions for anybody?
That was very informative, though. Thank you.
Yeah, thank you guys very much for being here today and also for all that you're doing, in particular for the youth of the county. So thank you. Okay, moving along through the agenda. The next item on the agenda is the Garrett County Purchasing Department. Mr. Knoll, what do you have for us?
Oh, yes, sir. This was a bid number 2011-05 that was advertised for the Hoyes Run Water Treatment Plant project. This was a project to explore and add a water source at the Hoyes Run wells. We did receive 3 bids for the project. However, there was discussion that due to the current work on the Thayersville water connection and to secure funding for this project in the future, and we have estimates from 1.8 million to just over 2 million, that we reject the bids at this time and we'll seek other opportunities later. So with your approval, we will reject bid number 2011-05.
All right, any questions for Mr. Knoll? Hearing none, do we have a motion to reject bid number 20-1105?
Make a motion to reject that bid.
All right, we have a motion. Do we have a second? Second. Motion and second. Question on the motion. All those in favor say aye.
Aye.
Opposed, motion carries. We also have some board appointments. We'll take them all at one time, one for the Garrett County Commission for Women and a couple for the Emergency Medical Services Region 1 Advisory Council. Mr. Knoll, what do you have?
Yes, this is a request from the Commissioner for Women to appoint Yolanda Michelle Harmon to the commission. Ms. Harmon had previously served on the commission and she moved away for employment, and she has returned to the area, and they would like to have her reappointed to the commission. Her term would be from a 3-year term till September of 2024. We also have appointments to the Emergency Medical Services Region 1 Advisory Council. Region 1 Advisory Council consists of Allegheny and Garrett counties. We have reappointments to the board. The first one is Dr. Stephanie Sisler, who we just heard from. John Frank is our emergency manager, and Cheryl Rexroad, who would be our Garrett County at-large member. And then a reappointment, those are reappointments, and a new appointment of Alan Ward to serve on the board.
And all these people are willing to serve in these capacities.
Yes, they are.
Any other questions for Mr. Knoll? Hearing none, do we have a motion to approve the recommended appointments?
So moved.
We have a motion, we have a second.
Second.
Motion and a second. Question on the motion. All those in favor say aye. Opposed? Motion carries. Next item on the agenda is a public hearing for the Garrett County Department of Planning and Land Management, the Agricultural Land Preservation District. Before we turn it over to Gary Aaronholt from that department, I need a motion to close the public meeting and open a public hearing.
Make a motion to close the public meeting and open public hearing.
All right, we have a motion, so we are now in a public hearing, and Mr. Aaronholt, I'll turn it over to you.
Thank you, gentlemen. I appreciate your time this afternoon. We have 3 properties in the Bear Creek Rural Legacy area to consider. Tom and Mary Rosser along Accident Friendsville Road, 126.05 acres. Chester Yoder along Harmon Road, 172.25 acres. And Stephen Margroff along Cove Road, and that's 51.9 acres.
All right, does anybody have any questions for Mr. Aaronholt?
Just a point of reference, so these have been reviewed by the Agricultural Preservation Board and the Planning Department.
That's correct. The Ag Advisory Board and the Planning Commission have approved all 3 properties.
So this, obviously a public hearing with no public. If you have comments on these properties or the program, you can email gccomments@garrettcounty.org through Friday, January the 29th. So if there are questions or comments about that, please once again email gccomments@garrettcounty.org in relation to the agricultural land preservation and those particular properties.
Mr. Chairman, if I may real quick, Gary, could you give just a very brief explanation of what this is so people know what we're talking about? I'm sorry.
Sure. Yeah, the agricultural preservation districts are available for agricultural producers, and they're able to receive a tax credit by entering into that program. And it also pre-qualifies applicants for state programs such as MALF or Rural Legacy, where they can sell an easement on their property. So this is kind of the first step in that process. The properties we're considering today are all intending to apply for Rural Legacy funding.
And Garrett, does this mean that they give up the rights to develop that property now?
That's correct. The agricultural district with the county is a 3-year commitment. After 3 years, folks can get out of that program unless they sell a permanent easement through one of the state programs.
And if they get out, then they have to pay back whatever taxes they did not pay?
That's correct. If they enter into the tax credit agreement and they decide to get out after two or 3 years, then they would have to pay back the taxes plus penalties.
Thank you.
Once a producer enters into a permanent agricultural easement, there's no risk of that property coming out of the easement because of perpetual. So there's no risk of the tax credit having to be paid back at that point.
Thank you, Gary.
Thank you very
You're
much.
welcome.
Any
Thank
other
you, gentlemen.
for Gary? Gary, do you have anything else for us?
No, that's it. Thank you.
All right, thank you very much. Appreciate it. At this time, we need a motion to close the public hearing and reopen the public meeting.
So moved.
All right, we are back into the public meeting and announcements. The next scheduled public meeting will be Monday, February the 1st. Check out www.garrettcounty.org for meeting information. Does anybody else have anything they'd like to bring up? Hearing none. Mr. Knoll, you have anything else?
No, sir, do not.
All right, do we have a motion to adjourn? Meeting adjourned. Thank you all very much.